My dad says, I don't know how you made it out of that truck alive.
When you're laying there in bed and you're not getting any better, you begin to wonder.
Learning how to re-walk again was like, can I do this?
Being a nurse and sometimes knowing too much is worse than not knowing anything at all.
You know, I couldn't move on my own. I broke bones on all sides of my body, so I couldn't even turn myself in bed. And, you know, as 19, I was used to doing things for myself and being independent, and my mom would say stubborn to a fault. And I found it very difficult to learn the humbleness it takes to ask someone else for help, even in the most mundane tasks as turning over in bed or brushing your teeth. You know, I know how lonely I felt being surrounded by people and having quick interactions with doctors and my nurses and PCTs, but still feeling so lonely.
In my darkest time, you know, I hadn't slept for most of a week. I hadn't gone to the bathroom for a week. I hadn't eaten anything for a week. It was just, I was exhausted. But every day, this dietary employee would come in, and man, I tell you what, when she would smile, walk in the room, as much as I didn't want to see that food, she would come in and she would have a smile on her face, and she lit up my room. She lit me up. And it turned out to be one of the best experiences of my career. It's like why I do what I do. Sorry, it's a little emotional because at that time I didn't know if I was going to make it.
Tracy, the nurse manager, she sat me down and went through the chart with me to say, you know, this is the findings, it's not good. And she helped me realize that I wasn't making the decision, I was just helping Mom make her decision. And that meant a lot to me. Kind of made me miss being a bedside nurse a little bit, because I wanted to get my hands in there a few times. You know, when I was at the bedside, we always worked as a team. So I just wanted to be part of that team again to help turn her or bathe her or whatever needed to be done, start her IV or anything like that. 'Cause I just felt like it would make me more useful to her.
When you can't move, scary. When you can't get up and go to the bathroom, scary. So when another patient is there and they call for that help, go there. You never know when you got to be on that other side.
And I think sometimes we tend to focus on the bigger aspects of care when, you know, what meant most to me is a nurse taking time to talk to me. I was feeling a little lonely at night, or helping me walk to the bathroom, or brushing my teeth in the morning. Because I think that we tend to forget about those little things, and they really make a difference.
When someone else is on that other side, it can be me, my mom, you, or anybody. Make that extra step. That extra step means a lot to anyone, a child, a mother, a grandmother, anyone. One of the small steps makes a difference. It made a big difference to me.
I talk about this experience as a patient and how everybody's important, that nobody's better than anybody else. They all have an opportunity. We all have an opportunity to impact somebody's life. I use the words change a life, change a life. That this is far more than just a paycheck. It's you know, the business that we're in, we all have the ability to change somebody's life.